Hello. So for this assignment, for the skill scenario, I will be using prompt number 3 to show Jasmine's 38 prenatal visit. For this assignment, I do not have all of the tools that I would typically have because I just moved and I'm waiting for my stuff to be here. So for getting vital assessments or listening to fetal heart tones, I will be simulating that or talking it through so it can still mimic as if I did have those the equipment. So with that being said, I will now start that prompt. Hey Jasmine, how are you doing today? It's really good to see you on your 38-week appointment. Before we get started, would you like to go weigh yourself as well as use the bathroom and leave a sample? And when you do that, I'll go wash my hands off of, and we'll just meet back in 5 minutes, okay? Hey Jasmine, perfect. Did you leave your sample in the bathroom? Okay, we'll go check that in a second. And what did you get for your weight? 152. Perfect. And as I mentioned, I did wash my hands when you went to the bathroom. So before we get started with the vitals and everything, I wanted to kind of check in with you and see how you're doing at this part in your journey in your pregnancy. You're doing good. You're just really tired. Well, that's normal. Pregnancy is a full circle. Definitely rest as much as you can. We did check your vitals. We did check your iron levels again at 28 weeks, and your iron is still appropriate, which is good. So just try to sleep as much as possible if you can. As well as I wanted to kind of talk about your diet. How are you eating? I know that you mentioned the last couple appointments that you're not having as much, you're getting full, you're not feeling as hungry as often. So I would just recommend snacking as much as possible. Definitely trying to get those high protein meals. And it's okay, like I said, snacking if sitting down and eating a full meal kind of seems intimidating and it seems like it's hard for you to do. So some cheese and nuts throughout the day can kind of help. Some beef jerkies and meat sticks and high protein smoothies can kind of help with that as well. So that way you are still getting full and you still putting that protein into the body, and it might even help with you being a little bit sleepy. Just add some dark leafy greens in there if possible. Do you think you're getting about 80 to 100 grams of protein a day? Perfect. What about your hydration? How are you doing with that? Okay. So are you still feeling thirsty with your 4 to 5 bottles of water? You are feeling content? Good. So that's what we want to make sure with that. Do you mind if we can go ahead and get your vitals? Okay. So I'm going to start putting this blood pressure cuff on your arm, and I'm going to pump it up, and I'm going to listen. Okay, I have 118 over 76. Perfect. Do you mind if I check your pulse? Can I see your hand, please? Okay. Perfect, 70. And again, we already got your weight. Perfect. Now let's talk about, are you able to move your body? I know we kind of talked about you wanted to do a little bit prenatal yoga. No, you haven't been able to, but you've been walking. That's really good. How often do you think you're walking, or how often are you walking throughout the week? 2 to 3 times for about 45 minutes. That is perfect. And how is your emotional state? Are you feeling stress? No, you're just waiting for the baby to come. You're just ready to get out. That makes sense. You're almost there. You're at 38 weeks. Just tell yourself you have 4 more weeks. Your baby will definitely be here by the end of the month because 4 more weeks from now. So just tell yourself that, and it'll be perfect. How are you getting sleep at night? You getting about 8 to 10 hours? That sounds really good. Are you feeling rested in the morning? You are? Okay, that's really good to hear. And how are you feeling, baby? Are you doing those kick counts? You getting about 10, you're getting 10 movements within the hour? Good. And And again, I just wanted to remind you, the older the baby gets in your stomach, the older you get in gestation, baby, you won't feel that, jab and punch and stuff that you'll feel in that earlier assessment. Baby's more so moving because they're kind of getting out of space and stuff like that. Okay. Or have you been getting any Braxton Hicks contractions yet? A little bit. Oh yeah, you did say that you were getting them very early on. Um, Good. So your body's just getting ready for birth and labor. Those receptors, the closer you get to having the baby, the more you kind of get more Braxton Hicks, and it just kind of getting your body prepared for that end goal of having your baby. Okay. Are you having any headaches? No. Visual disturbances? No. Perfect. Are you having any swelling in your hands and feet that kind of doesn't go away after you relax? No, they're all good. Perfect. Do you mind if I actually take a look at your hands and feet? Thank you. It looks like I'm touching it. You don't have any type of pitting. You're having really good capillary refill, which is perfect in what we want to see. Are you having any upper stomach pain? No? Any weird vaginal smells or vaginal bleeding? No? Perfect. Any discharge? Just normal discharge? Okay, perfect. How are you going to the bathroom? You're a little constipated? Okay. So with that, what do you eat? So we did talk about your diet, but we can also try natural things at first. So you can try to put more fiber into your diet. So a little bit more greenery, a little bit more apples. If you don't like that, we can try some magnesium glycinate that's also in the Calm. You can take that before you go to bed, and that kind of helps you sleep as well. That helps with the swelling if you did have some but you don't. So all of that is kind of good. That'll help you to go. Okay, so what we're going to do now, with your permission, is that we're going to go ahead and check in. Actually, before we do that, I wanted to talk about your GBS test. So at your last appointment, your group beta strep did come back negative. So that means that you don't have that bacteria. So that means that we don't have to talk about antibiotics for you if with that case, because it did come back negative, which is really good. And before we get started on the assessment for baby, I wanted to talk about newborn procedures. Again, we did talk about it in the last appointment. I just wanted to know if you had any questions about the newborn, the eye ointment, the erythromycin, if you wanted to get the vitamin K shot or the injection, or with anything like that. Not at this time, we're still trying to decide. Perfect. You can take all the time you need. And again, we will always ask you before we do anything. So when you have the baby, we'll ask if you want the eye ointment, if we'll ask if you want that vitamin K injection, or if you want the oral drops as well. Okay. So if you can lay down, we're just going to check on baby. So with your permission, so first we're just going to palpate and see where baby's at using the Leopold's method. So we're just going to check the top of the fundus just to kind of feel that first pull and see where baby's at. And then after that, I'm just going to check the sides to see where I can get the front and the back at. So it looks like baby's back is on the left side, which is good, and it does feel like I have a butt at the top of the fundus, which is also really good and what we want to see. So now I am going to check for the lower part of your stomach to see if baby's engaged and what that looks like. Okay, that feels really good. And now I'm just going to check for pockets of the fluid inside your stomach to make sure that baby looks like they feel like they have a good amount of amniotic fluid inside of here. And they do. That looks really good. Okay, so with your permission, I am just going to again take the tape measure and check for the fundal height. With that, do you mind if I check for your pubic bone? Okay, I'm gonna check for your pubic bone here. I'm gonna put it here and over your stomach. Could you take a deep breath for me and let it out? Perfect. You are lining up at 38 centimeters. And now I am just going to listen to the baby's heart tone with the fetal scope. Okay. I am going to put the horn of the fetal scope on where I see the back on the left side. I do hear it, but I'm going to move it around in like a little crescent circle so I can see where I hear it the loudest. Okay, now I'm going to listen for about a minute and a half just to listen for increases, decreases, any variability and stuff like that. So give me 1 second. Perfect. I did hear some increases, which is really good. Baby is moving around a lot. Would you like to listen to them? Okay, here you go. Perfect. So next, we'll sit you up and put you down. And did you have any questions for me? Perfect. Well, it's really good to see you at your 38th visit, Jasmine. Bye.